All right. It says, Mr. John Smith, comma. And here's the first thing that I want to teach. In the NCLEX, they're not going to give you a name. They're not going to give you John Smith. They're going to tell you a 75-year-old white male. This is a good strategy that you can do. Give a name to your patient. What's the difference, Professor? Why is that important? Giving a name somehow makes your brain focus and concentrate a little bit more because you're kind of putting a face to the scenario. It works for me. I hope it works for you. If you don't like it, no big deal. You don't have to do it. But I like to put a name to my patient. So Mr. John Smith, because the original question says a white male. So Mr. John Smith, a 75-year-old white male, has a history of mitral valve regurgitation and left ventricular failure. Why is this important? My patient is a cardiac patient with two conditions: mitral valve regurgitation and left ventricular failure, heart failure. Mr. Smith came to the emergency department with symptoms of increasing shortness of breath over the past week and was transferred to the ICU. So let's do the keywords here. Elderly male, mitral valve regurgitation, left ventricular failure. The patient came to the ER, now transferred to the ICU, but they're giving me information, clinical manifestations. Shortness of breath over the past week. So the patient now has respiratory problem. So this cardiac problem is manifesting as a respiratory problem. The ICU nurse immediately goes to check on Mr. Smith and notice the following. So now, where is the case scenario centered? In the ICU. So you need to know that. He indicated that he feels very short of breath. Why is this important? He's talking. The patient is talking because he indicated that he feels short of breath. Hey, very short of breath. The nurse noticed that he was laying in bed, pale, with circummoral cyanosis, and respirations appear labored and rapid. So now the nurse conducted an assessment and noticed that the patient is laying in bed. Is that important? Yay! The patient is laying in bed. That position is not good for difficulty breathing. So I wonder if a question comes related to that. Maybe, maybe not. But that is important to keep the back of your mind. So the ER nurse put some notes how the patient came. The patient came awake and alert. Took vital signs, 110/85, a little tachycardia, O2 saturation 89, respiratory rate 26. So we have some respiratory difficulties here. The nurse in the ER gave furosemide 100 milligrams IV, and the patient was placed in oxygen via nasal cannula at 4 liters per minute. So here comes the first question. According to this scenario, what is the action that the ICU nurse should take first? Listen to breath sounds. Ask when the dyspnea started. Check the oxygen saturation, or place the client in high Fowler position. So So now we have a priority question within the case study. So what do we have to do? We have to relate to the case scenario and see which question is more pertinent. But since this is a priority question, I need to say, what is my first action to take? I have to think of a prioritization strategy. And there are several strategies that you can use here. I'm not going to go into details because that's not the purpose of this training. But you can use here the assessment versus implementation strategy. You can use here the changing position strategy. You can use here the Maslow's hierarchy of needs strategy. The correct answer is answer number 4. Why? Why is answer number 4 the correct answer? Because my patient has difficulty breathing. My patient is pale with circummoral cyanosis. Respirations are labored. That position that I found the patient laying in bed is not helping. So changing the position will help with A, B, C. Professor, why not 1? Why not listen to breath sounds? Because this is an emergency and I need to implement and not do an assessment. So 1 is eliminated. Why is 2? An answer that I will eliminate. Same thing. Assessment is an emergency. I need to implement. Plus, when did the dyspnea started? It's not really that important. It's not going to help me fix the problem now. Why not check the oxygen saturation? Well, important question here. Do I need to know what the saturation is now? Yes. I need to know. This answer number 3 validates the scenario. But why is not the priority? Because in a medical emergency where the nurse has already conducted some assessment, the priority will be to implement, not to assess.